Polycystic ovary is an endocrine and gynecological problem or hormonal imbalance that happens in many women. So about 10% of women, 1 in 10%, 1 in 10 women, or even more experience polycystic ovary syndrome. And one thing that I've commonly encountered is that a lot of women who have this PCOS or PCOS tend to feel that they are less of a woman or less feminine than other women. And what I tell a lot of people is that it's a very common condition. If you bring 10 women, there's a likelihood that one or two would have polycystic ovary syndrome. So PCOS doesn't make you less of a woman. It doesn't make you less feminine. Yes, you might have some, increased growth hair, hair growth on your face, under your chin, on your chest, and some other parts of your body. But it's an endocrine problem. It's a hormonal imbalance. It's not something that you've done to yourself. It's something that just happens. It's not really clear why it happens. We'll find that people with this condition have high levels of insulin. They've got insulin resistance. They've got higher levels of androgens like testosterone and some other androgen hormones. And it's manageable. So many people with PCOS will conceive, will get pregnant naturally. A smaller percentage might struggle to conceive, and there are tools available to support such people to make conception possible for people who have difficulty conceiving. So the message is PCOS doesn't make you less of a woman. It doesn't define your femininity, whether you're more feminine or less feminine. If you think you have PCOS and you need support or confirmation, speak with your doctor. We'll run a couple of tests. We'll examine you, and when that diagnosis is made, we'll explain what it means, and we'll usually treat the imminent condition or the imminent struggles. If it's the facial hairs, if it's irregular periods, we'll try to treat that. If it's difficulty conceiving, then we'll usually refer you to the gynecologist or fertility specialist who will then assess, run some more investigations, and then help you provide that support that you need with conception.